who do you think is to this oxygen shortage? Because you were telling me about an incident in your own hospital as late as last night, where oxygen you were landing into an emergency situation with oxygen. Can you tell us what happened last night in your hospital?
Yes. See, broadly, one has to understand the scenario as it is evolving right now. There is a certain requirement of oxygen throughout the country on a daily basis. Now, here is a sudden disaster that has happened, a crisis, and that has increased the requirement of oxygen 4 to 5 times as compared to normal. So clearly, we don't have that surge capacity. So there is a mismatch between the demand and the supply. Now, what happened to us last night, for example, is that our liquid oxygen tanker, which was supposed to arrive at our campus, which usually does in the evening, was diverted to another COVID care center because there was a crisis of oxygen there because their regular supplier could not provide the liquid oxygen. So it was diverted there, and which is okay. I mean, clearly at that moment in time, their emergency was greater than ours because we still had supply till 10 o'clock the next morning. So then we had to kind of run around a bit, talk to higher authorities, and therefore get that sorted out. And then we had our tanker arrive rightfully today morning at 9 o'clock. And so whatever emergency that could have happened was averted. Having said that, I mean, one has to be fair to the government as well. See, the thing is, you can always criticize and say, why did they not have this surge capacity? Valid point. We should have anticipated this whole crisis, whether it is oxygen, whether it is remdesivir, whether it is ICU beds, whether it is ventilators. Somewhere there was a degree of complacency that entered because of the dip in COVID numbers in November, December. So somewhere overall, maybe all over the country, everyone went into this kind of relaxed mode saying that COVID is gone once and for all. As much as it was a tiny virus, we failed to respect it. And sure enough, in January, February, when everything was opened up simultaneously, whether it is the movie theaters, schools, shopping malls, etc., and these kind of super spreader events like marriages and even electioneering for I don't need to tell you details of that.
Yeah.
These are all huge super. So it is a conflicting signal that goes. On one side, we say that we should maintain social distancing, wear masks, do hand sanitization, etc., etc. And at the same time, you see these massive crowds, at either religious events or at electioneering. And sure enough, then it shows the priority in terms of last year, to put it very bluntly, when COVID first hit us, the priority was health of the country, healthcare. That was the priority. Everyone was scared. This year, when you even listen to the highest authorities in the land, the priority is clearly economics, the economy. Healthcare is not the priority this year. It could be in second or third position, but definitely not number one as it was last year. So when you look at that, this all is a reflection of that whole system. Because of that laid back approach that COVID has gone away, so we don't really need to prepare for any kind of eventuality. It caught us completely unawares.